Center for Innovation and Technology is offering you a golden opportunity to speak directly to your market at an affordable price. We also offer media training workshops, live streaming, documentary production, and events management. Get in touch with us today on the following numbers: +263 867 711 0290 or 0718 100 235. Don't forget to subscribe to our social media platforms. Like our Facebook page, Center for Innovation and Technology. Follow us on Twitter @SiteZW. And you can also check out our website, www.site.org.zw.
It's a good morning to you. This is Zenzel Ndebele on Asake Online. The program is the Breakfast Club, and every day in the morning we bring you different programs where we look at different issues that affect Zimbabwe. Last week was the Zimbabwe International Trade Fair, and a lot of people were at the trade fair exhibiting different things, artwork, business, government departments, and all sorts of things. Even kids were there just to paint their faces and sit on the lawn and have the picnic. But as we went through the Zimbabwe International Trade Fair, we came across the stand for United Nations, and we thought it was going to be one of those things where we sit down with the officials from the United Nations to actually find out what the United Nations do. Most of the times when we think about the United Nations, we always think about peace, about peace missions and conflict resolutions. But the conversation that we had with the representative from the communication office, we discovered that the United Nations is actually doing a lot of work in Zimbabwe. Under their program, which is called the Zimbabwe United Nations Development Assisted Framework, between 2016 and 2020, UN is going to spend about $1.2 billion in Zimbabwe. That translates to about $400 million a year. This is quite a lot of money, taking into consideration that our government should be doing something about our livelihoods, and the Minister of Finance always tells us about surplus this, surplus that. So if you have the surplus that we are talking about, why are most of our programs in critical areas being supported by the organizations like the United Nations? We actually get assistance in food security. United Nations feeding a lot of people in Zimbabwe, and they're also supporting a lot of irrigation programs. They're also supplying medicine in hospitals and paying some of our critical staff. They're also training people, and people are benefiting in terms of HIV and AIDS programs, gender equality, and many other programs. So this is when you start to realize that while our government is busy talking about health for all or middle class income by 2030, some people are actually doing the work on our behalf. While these comrades are busy jumping about surplus, other people are getting down to business and helping our people. So listen to this program where we're talking to United Nations. A few months ago, we also had an opportunity to talk to some of the program directors in the United Nations who were explaining about the programs that they do in Zimbabwe. So I hope this program will be very informative as well as empowering you and give you the knowledge to argue with those in power when they tell you about the surplus in government.
The United Nations has programs that are guided by the Zimbabwe United Nations Development Assistance Framework. And this framework was developed by the United Nations in Zimbabwe, by the government of Zimbabwe, donors, NGOs, and other interested groups, including youth groups, church groups, to ensure that it is all-encompassing and that it covers the needs and the interests of the people of Zimbabwe. And having said that, the programs that are being covered include food security, social services, poverty reduction, HIV/AIDS, gender, and then the last one is poverty reduction and governance. They form the umbrella of the activities that are undertaken in the country.
Let's talk about especially looking at food security. This year we are likely to have a serious drought. So what are some of the interventions that are likely to carry out?
For this year already, that drought has been predicted. The UN has not been sitting on its laurels. A flash appeal has actually been launched in February. That was launched in February, aiming to raise 234 million towards drought and humanitarian assistance for those who are affected. For those who are now affected by Cyclone Idai, an additional 60 million is earmarked to bring the total to 294 million, covering drought, Cyclone Idai, and humanitarian needs.
If you look at the Zimbabwe program, it's running from 2016 to 2020. During this period, how much money do you expect to spend on different programs in Zimbabwe?
For the past 3 years, we've spent 400 million a year, which means that as of today, the United Nations has spent 1.2 billion in Zimbabwe for those projects I mentioned, which are running under ZUNDAF. According to plan, we could spend another 400 million per year, bringing the total to about 2 billion.
How does that compare?
You find that different countries would have different figures according to their own needs in their own countries. So I would say that the amount that has been stated in our ZUNDAF is according to what is actually required in this country. Yes. And this has been a very good learning experience for us to be able to. We've been coming here for 5 years. This is our 5th year, and we are just overwhelmed by the level of interest.
The ordinary person will always ask that, okay, if I need assistance from
rights of people, governance issues, all those benefited from the United Nations. It may look like people are not benefiting, but this is one way that is maybe not that direct to some people if you're not in an abusive relationship.
2017. WFP had done a complete transformation on its relevance, and the communities remain the way over the last 4 or 5 years. We focus in 17 districts across the country where we are now looking at multi-year type of asset creation that sort of builds on layers of resilience. So now we have the deep tank. Perhaps next year we would be looking at nutritional gardens or weir dams, so that we have water harvesting systems that would complement, grazing areas for these cattle, but also would allow households, the opportunity to diversify their livelihood opportunities. So our thrust in Zimbabwe, as we've seen here, and I must say I'm very much impressed with this asset and with the type of commitment that the community has demonstrated. Remember, even in livestock, there is a lot of resources. When you look at the state of these cattle, I've never seen such huge bulls in my trip around Zimbabwe. These are well looked after, healthy cows that you could fetch quite a good amount of money. And as we heard from some of the community members, things like school fees, medicals, medicines, we look at these things and think that they are just there. But if you do not have resources, there is no way you would be able. We now know that because of the advanced health services provided, the infant mortality rate is reducing. We know that there are health facilities now that are bringing up, but households have to pay for their medicines. They have to pay transportation to get to these clinics. Where do they get the money? And we know that this is an agroecological zone 4 district where meaningful agriculture is constrained as a result of the amount of rainfall and the type of soil. And therefore, livestock is perhaps the predominant livelihood opportunity. So looking after the livestock is like your insurance card, because once you preserve the cattle and you fatten the cattle, you would be able to get investment returns by selling your cattle at a very competitive rate. So I'm very much impressed. And like you had in Binga, we've been here since 2012. And we have worked with communities to create over 15 assets across about 6 wards. And now that we have sort of changed our approach, we would be in this district, in this ward, for the next 3-4 years, so that we work with the community, creating layers of resilience year in, and by 3-4 years, this community would be self-sufficient with diverse livelihood opportunities. That's the essence of our resilience strategy, and that is the objective, that by 2030, every Zimbabwean can afford food anytime, every time, throughout the year, which is our mantra, zero hunger for every Zimbabwean by 2030.
Zimbabwe should be very proud, and I think one of the things we've missed out is actually being that proud of what we have achieved here as in partnership, of course, with the Ministry of Health and led by the Ministry of Health and Childcare. But the fact that Zimbabwe has been able to reverse the trend of HIV/AIDS, being able to provide over 1 million people with ARVs, and doing so in a manner that actually we have seen very little stockouts to none. We have seen very little wastage of medication. And I think that is part of sort of the investments we're also making as a principal recipient of the Global Fund, to say the savings we make by delivering of those medications, can we invest those in health system strengthening? So that's where you've seen the cold chain coming from. That's where you've seen the Solar for Health coming from. Those are not direct resources that were for the HIV/AIDS response, but as a result of savings, by doing our work together with the government in a very efficient manner, we could then invest in health system strengthening.
The programs that UNICEF is doing in Zimbabwe in general are around health, nutrition, child protection, education, HIV/AIDS, social protection. Those are the main programs that we're implementing throughout the country. Here in Binga, we have seen this morning a number of those programs that have been implemented here, not only in our regular programming, but also during the emergency, which we had last year in terms of response to the drought. We have seen this morning, for example, programs in health and nutrition. We were at the clinic, we have seen kids being immunized. We have also seen medicines available. We have seen also ready-to-use therapeutic foods for children who are severely acutely malnourished, but we have also seen ready-to-use supplementary foods for children with moderate malnutrition. We have also seen the presence of water and sanitation programs, both in the health clinic but also in the schools that we have visited this morning. We have seen through this SIG program how we are improving some of the schools where the new structures and buildings are being built. We have also seen how that SIG program is also supporting those schools to have materials for kids to be seated on, but also for kids to receive books and other materials in those schools. And then we have seen on the ground how the health workers and community workers are supporting mothers to learn more about nutrition of children of young age, how they can improve the recipes for them to make sure that they're receiving all the nutrients that they need for them to grow. So we have really seen a large battery of programs which are not only diverse but also integrated, and I think that's extremely important for us, making sure that whatever we do is integrated, both health, nutrition, education, but also WASH. And the most important thing we have seen also this morning, and which I'm very pleased of, is the fact that these are some of the programs coming out of the emergency and now getting into development. So not disconnected completely from both emergency and development, but really having that continuum of not only responding to an emergency and then coming out of that emergency, making sure that the program continues as a development program. So building the resilience of people. However, what you have also seen is that there are many needs, unfortunately, especially for some of those schools. We are trying to do our best, but there is still much to be done for those children. We have seen in very hard conditions, some of those kids are studying, and there is only little we can expect for them really in terms of learning, but also in terms of development. So a lot of work to be done still, but I think much was also done in the past and going forward. I'm happy to see that the council and the authorities in this district are quite committed.
The last 3 days have been really fantastic experiences, traveling together with my colleagues, the head of the World Food Program, the head of UNICEF, the head of IOM, and the country director of UNDP. We began by visiting human rights related clinic, which was really fantastic, where a lot of services element and awareness on the right and constitutional issues, promotion of peace were communicated with the communities. there was a lot of enthusiasm from those people, even in the cold weather. I met a 96-year-old woman there. So that was the beginning, and then we visited some other areas as well. Not farm warehouses where the UNDP Global Fund has been providing some support in terms of disposing medicine, and then solar for power program at a health post. Then the following day we got engaged into visiting resilience building program where farmers were supported with the market link and financial credit support. And what amazing there was at 0.4 hectare of land, the farmers were able to be self-sufficient, getting $2,400 per year, sending kids to school and meeting their various needs. And then we also visited a program supported by World Food Program, supporting the improvement in food security, where there was also a link between the JDRBF UNDP program in terms of, contributing to food security. And there, the animals' deep tank asset was built, along with many other assets like dams and nutrition gardens. So far, they had done about 15 of those asset facilities. And then we drove long to Binga, about 1,000 kilometers from Harare. And today we had a fantastic day visiting schools, nutrition center, and then social protection or cash transfer to the most vulnerable group. What I admire out of all these engagement is how UN and the partners have been helping to improve people's life, building their resilience, and contributing to the basic social services, health, education, and social protection.
I hope this program was enlightening to you. And next time Tuli Ngube tells you about surplus, ask him why organizations like United Nations still spend over 400 million a year in Zimbabwe if we really have surplus. Ask him why most of our medicine is actually paid by agents like United Nations, global AIDS programs. What is happening to our 7% airtime tax? What is happening to our 2% transaction tax? What is happening to our AIDS levy? Because these are the monies that are supposed to be helping our people in hospitals. But these days, if you fall sick and you go to any of the public hospitals, because our hospitals have become death traps, yet we have governments that always tell us that they have surplus. My name is Zenzele Ndebele. Till we meet again tomorrow, have a good day.